Hi students, thank you for your time today. Welcome to our mini lecture, Introduction to Herbal Drugs. A true course on Introduction to Herbs or Herbalism would be more of a 3-credit semester-long course, but as this topic is embedded into the curriculum for Introduction to Substance Abuse, now is our opportunity to discuss herbal drugs. So, how is a drug defined? A drug is defined as a medicine or substance which has a physiological effect when ingested or otherwise introduced into the body. That could mean pills, smoking, injection, food, herbs, tinctures, a wide range of things, even topically absorbed through the skin in some instances. So sugar, salt, and water could also be categorized as natural drugs according to the definition of any substance which has a physiological effect on the body and behavior. So herbs, how are herbs defined? Herbs are defined as any plant with leaves, seeds, or flowers that is used for flavoring, food, medicine, or perfume, for example, essential oils. Generally, in herbalism, roots are also included within the category of herbs. So knowing the plants, their chemical constituents, their history, their uses, their side effects, how to identify, grow, process, how to dose, how to prescribe these plants, or educate people on these plants is a specialized field of study. Due to the number of plants and their variables, it would be extremely challenging for the FDA to regulate every single plant in the world. So in 1994, Congress passed the Dietary Supplement Health and Education Act. Again, in 1994, Congress passed the Dietary Supplement and Health Education Act. So this act says that the FDA will not regulate any natural product, and by the FDA's definition, natural product includes anything that is intended for ingestion as a supplement to the diet, vitamins, minerals, herbs, botanicals, and other plant-derived substances such as amino acids, concentrates, metabolites, extracts, as well as other isolated plant constituents. So the FDA can only remove from market a plant if it is proven dangerous, such as ephedra, for example. So some example of the herbal drugs discussed in Buzz include ephedra, St. John's wort, ginseng, ginkgo, melatonin, and more. However, there are thousands upon thousands of plants in our world, and thousands upon thousands of plants that have medicinal properties. Hence the act in 1994 where it was ruled that the FDA would not regulate any type of plant substance used as a supplement to the diet. If one were to apply the definition provided for herbal drugs, it would also include cannabis and the plants involved in ayahuasca, as well as the plants that contain mescaline or psilocybin. However, the main difference has been that the FDA has decided that those plants and plant combinations have potentially dangerous and lethal effects, so they're classified separately. Some of the more commonly known medicinal herbs are actually found in most people's kitchen cabinets, and some examples of this would be sage, rosemary, and thyme, as well as kitchen herbs like garlic, cayenne, some of the herbs involved in curry, for example. Cinnamon also has medicinal properties, as well as nutmeg. So to include common flowers like dandelion, violet, yarrow, and perennials such as comfrey, valerian, rose petals, echinacea, and more, as well as the kitchen herbs, in the same category as plants like ephedra or the plants involved in ayahuasca brews, or San Pedro cactus, for example, or Amanita muscaria, to combine those plants as having the same dangerous potential as the ones that I just mentioned isn't accurate or logical. Hence the 1994 act passed by Congress that says that the FDA will not regulate commonly used plants that are included in the diet as supplements. So that could also include things like berries, Shishandra berries, elderberries, goji berries, even berries like blackberries and blueberries have medicinal properties. Raspberry leaf is also another popular, commonly known plant that has medicinal properties. So for thousands upon thousands of years, plants were used as medicine. Hence the Hippocrates quote, let thy food be thy medicine, and let thy medicine be thy food. So Hippocrates is known as the father of modern medicine. However, what is commonly not mentioned is that much of Hippocrates' training was based in herbal medicine. As you know, herbal medicine is the root and the foundation of most medicine systems throughout the world. Chinese medicine, Ayurvedic medicine, indigenous or shamanic uses of plants are all rooted, grounded in plant medicine. The difference between plant-based medicine and what we would call Western or allopathic medicine is that allopathic physicians, MDs, and naturopathic physicians are more often trained, their focus in their training is on pharmacological and surgical interventions. So oftentimes, if a person goes to their primary care physician and says, hey, you know, I'd like to take elderberry and Shishandra to supplement my diet, I'm interested in taking olive leaf or dandelion, or I'm going to take some osha root, which is now an at-risk plant, you know, to combat this congestion that I'm having. Most often, the allopathic physicians will tell a person to avoid those substances, not necessarily because those substances, those herbs, have a high potential, you know, of creating dangerous side effects, but more because they're erring on the side of liability, because they don't understand these substances. They don't always know the medicinal value of what nature has already given us. So with that being said, there are thousands of plants that are used medicinally throughout the world, which I'm sure I've said already, and I know I will say again. There are many different schools of herbalism, many different types of people who do employ herbs in their healthcare practices. There are also many different levels of herbalists. There are folk herbalists, family herbalists, clinical herbalists, master herbalists. There are Chinese medicine doctors, Ayurvedic health practitioners, naturopathic physicians, and more. I would also include shamans in that category. And there are MDs, there are some traditionally trained allopathic physicians who do have an understanding of the potential benefits of using one's diet, using supplements, using plants and herbs to help the body to adapt to stressors, to cleanse the body, the lymphatic system, for example, the blood, for example, to help to decrease anxiety and depression symptoms, as well as PTSD. So there are Western doctors, there are MDs, and naturopathic physicians, nurses, RNs, other types of specialists who do have some training in the what I would call, you know, traditional medicine systems in herbalism with supplements. And so if you're able to find someone like that, count yourself as very lucky and, utilize their knowledge and their skill as you consult them for your own health care. So when discussing herbal supplements, it's always, again, recommended to educate oneself, which is defined as self-care, as well as consulting with your healthcare professional. I always want to emphasize that. So moving on, when we are studying a synthetic or an isolated compound, an isolated drug, such as MDMA, DMT, LSD, THC, CBD, whatever the isolated compound is, it's a lot easier to identify which chemicals are causing which reaction. With raw and or processed herbs, the results of the plant constituent combinations may vary. Because we're talking about, again, thousands of different plants with thousands of different combinations of plant constituents, some of which are identified, some of which may not be. So it isn't logical or accurate to classify an herb that has a very high potential for dangerous side effects with something like garlic or elderberry or dandelion or comfrey or violet or plantain that grows commonly, is used commonly, and has the potential to be more effective than some of its pharmaceutical counterparts that we may see. So again, I'm going to emphasize that studying herbal drugs is a specialized field and that this is purely just an introductory video. So I'm going to stop the video here because we're already at 12 minutes, and I would like to discuss a few of the herbs that are mentioned in Buzzed, specifically ephedra, St. John's wort, and ginseng. So this is going to be part 1 of Introduction to Herbal Drugs. Thank you very much for your time and your attention, and I look forward to seeing you in our next episode, part 2 of Herbal Drugs.